Oh, wrong slide there. Starting off on the wrong side. Alright, sodium bicarbonate. Common trade names, yeah, you might call it sodium bicarb. It's just available as a generic though. It is an alkalizing agent and a systemic hydrogen ion buffer. So it interacts with the hydrogen ions in the body and converts them into water and carbon dioxide, which then both of those can be easily excreted out of the body. It causes a reduction in metabolic acidosis and moves the pH towards the alkalinic side. It is pregnancy class C. Indications would be metabolic acidosis, as in cardiac arrests, usually cardiac arrest lasting more than about 10 minutes. That starts to become more of an issue. Some overdoses for tricyclic antidepressants, aspirin, and phenobarbital. You can use it for those as well. And you're going to watch EKG changes for that and adjust your dosing accordingly. Hyperkalemia, and then crush injuries. Contraindications would be metabolic and respiratory alkalosis. You give them sodium bicarb, they're going to continue to become more alkalotic. Hypokalemia, and then electrolyte imbalances due to vomiting or diarrhea. Some adverse reactions to watch for: hypernatremia, so too much sodium, metabolic alkalosis, cellulitis, and inflammation around the site of injection. Seizures are possible, tetany, sodium retention, and then peripheral edema is also possible with it. Big on the sodium retention. Hypernatremia, peripheral edema, all those go hand in hand. So some drug interactions to be mindful of. It increases the effects of amphetamines. It decreases the effects of benzodiazepines and TCAs. And it may deactivate sympathomimetics. So that's why if we're giving this IV, or we should be giving it IV, we want to make sure we're flushing out our IV well between medicines or using separate IV sites, especially in a cardiac arrest when this comes into play. You push an amp of D50, then you want to make sure you flush your IV real good and then push your milligram of epi. So dosing for adults and kids is 1 milli equivalent per kilogram, either IV or IO. With the kiddos, you might want to dilute it down. Standard concentration is 8.4% solution, and then for the kids, you might want to dilute it down to 4.2%. And then keep in mind, if you're running an overdose, it may require higher dosing. Just follow your local protocol, of course. Duration starts working pretty much immediately. Peak effects within a minute or two, and then it lasts for 10 minutes, or it can last a little longer. And no other really special considerations on this one.